Memorial Health System provides comprehensive health services that meet the needs of the region we serve, and we are proud to present Memorial Health Radio. Here's Melanie Cole.
When it comes to breast cancer, early detection is key to better treatment and better outcomes. My guest today is Dr. Rajendra Bhati. He's a surgical oncologist with Memorial Health System. Welcome to the show, Dr. Bhati. How important is early detection of breast cancer?
Good morning. Thank you for having me on the show. Early detection is key, and I think that we'll find in many different sources, depending on who you talk to, that a good self-breast examination, as well as annual mammography for average risk women starting at 40 is what most societies will recommend.
I'd like to go back for a second to self-examination. Give us just a little bit of a lesson, because women don't always know what it is they're supposed to be feeling for. There's lumps and things that are always different and changing. What are we supposed to be doing?
That's a good question, and you find that oftentimes benign lesions of the breast will often trigger worrisome states for women when doing the self-breast examination, and is the fundamental correction on whether or not the recommendation should be formal that a self-breast examination should be done, because it needs to be done in the appropriate clinical context. I do recommend them personally, but I think that you'll find that depending on who you ask, it'll vary widely. I think that it is beneficial just because each individual woman will know her breast, and really what you worry about are changes. I recommend doing them at least every month. Usually in the shower is when a lot of women choose to do them. You can either do them as a side-to-side motion on the breast, kind of what's called the lawnmower technique, or you can do them in a radial fashion, just going from the middle of the breast, expanding out in kind of like the spokes on a wheel, and looking really, I think, largely for any changes. Frequently, cysts of the breast or benign lumps of the breast will present as masses and can be worrisome. But I think really changes from the baseline is really the key and the goal for early detection of breast cancer.
So you mentioned mammograms starting at age 40. How often after that?
Usually every year. I think that you'll find that even stays true for women who have a personal history of breast cancer. Is done even on an annual basis.
So then tell us what happens after the mammogram. If something suspicious is found, then women hate that wait, Dr. Bhati. It's very hard. And so what do you tell women every single day about what comes next?
Sure. And so I think what's really important and what really can assuage fears and really, I think, separate different delivery systems is whether or not there's a breast program in place specifically dedicated to serve women who are facing the abnormal mammogram. Here at Memorial, we have a specific breast imaging dedicated department where they can take you from an abnormal screening mammogram all the way to invasive biopsies and complex imaging modalities, including breast MRI and digital mammography. And so throughout that entire process, we've dedicated a navigator that will specifically guide every woman through the process should she be faced with an abnormal mammogram. Usually when an abnormal screening mammogram occurs, additional imaging is warranted, whether or not it's additional imaging views via mammography versus ultrasound, even or via breast MRI, and sometimes that'll lead to an invasive biopsy. And our navigator, who's fantastic at this, is really able to coach patients through it, along with the breast radiologist, through this entire process. And in many cases, can go from an abnormal screening mammogram to a biopsy even within the same day. And so it's really nice. I think nationwide you'll find even with dedicated breast centers, the average time from screening mammography to biopsy is about 14 days. But here at Memorial, we're averaging about 7 days from screening mammogram to biopsy, which is something we're really proud of.
Dr. Bhati, tell us about your team at Strecker Breast Clinic. Who else is involved besides the nurse navigator?
So this is another thing that I really am proud of is that once a woman is faced with that breast cancer diagnosis, there are so many moving parts that have to become in sync and in coordination to execute her care. And so what you'll find is oftentimes in not systems that aren't coordinated that a patient will see, say, a medical oncologist or a radiation oncologist or a surgical oncologist, and we'll have to do a round robin, so to speak, with visiting all these different specialists, and oftentimes that can take weeks, if not even months, to occur, and that represents a delay in care, and so instead of the traditional model where the patient goes to see the physician, what we wanted to create here is where the patients or where the physicians come to the patient. And so we've designed a specific multidisciplinary breast clinic to focus specifically on these patients, to where they have the opportunity to meet with the medical oncologist, the radiation oncologist, the surgical oncologist. On top of that, the navigators, the social workers, the patient financial advocates, and visit with our resource team, our therapists, and it really is a chance, all in one setting, to see all the resources that we have devoted specifically to care for a woman facing with breast cancer. So we essentially boil down into one morning what previously had taken many weeks, and so I think you'll find that it's reflective of what has happened on the diagnostic side of things, where we can take a woman from abnormal mammogram to biopsy very quickly. That once that breast cancer diagnosis is established, we can take that newly diagnosed breast cancer patient through the entire treatment process and coordinate that for them. This is tied to our multidisciplinary breast tumor board, which is where all the specialists and ancillary staff sit down and discuss the unique aspects of every case, and then we deliver a recommendation at the end of this tumor board to the patient together as a consensus group. And I think that you'll find that offers a number of advantages because we all know that each patient is unique, and all of our perspectives are different at times, and as a group consensus that maximizes outcomes, minimizes errors, and I think that the patients find it most beneficial that way. Certainly we do on the treatment and clinical side of things.
Dr. Bhati, as a surgical oncologist, what's new? What's really exciting in the world of breast cancer?
Oh gosh, there's so much to talk about. I tell you what I think I've always appreciated the most of breast cancer specifically is that the amount of information is overwhelming. But I think the reason why it's so overwhelming is because there's so many good options, and those options vary from breast conservation, lumpectomies to axillary sparing surgery to genetic testing to complex reconstructive options from our plastic surgery team. I think that at times it can be overwhelming, but at the same time it's also nice that we can tailor what's a very complex sea of information and find that unique treatment plan that best helps the breast cancer patient. And so I think I'm most excited whenever I sit down to know that it's not going to be a one size fits all approach to an individual patient, but rather my biggest challenge is to find what treatment is best suited for that particular woman. So.
And why do you tell women to come to Memorial Health System for their care?
Well, I tell you, I think we have a lot to be proud of, and compared to regionally, I think there is no comparison to what we're able to offer. As we just mentioned, the diagnostic modality is streamlined. The delivering mechanism is streamlined with our multidisciplinary breast clinic. Our tumor boards are all done prospectively prior to initiation of any treatment, and with all the experts at the table. We're the only NABPC accredited program in the region, as well as accredited by the American College of Radiology for breast imaging as well. And so I think it's unique, it's expedited, it's organized, and it really has a lot of resources devoted to caring for the specific breast cancer patient. And it's not anything that you'll find within 2 to 3 hours of driving distance from us locally.
Thank you so much for being with us today, Dr. Bhati. You're listening to Memorial Health Radio, and for more information, you can go to mhsystem.org. That's mhsystem.org. Expect more. This is Melanie Cole. Thanks so much for listening.